So now this is for radioulnar joint. Ulnar joint, here we will be having proximal and distal radioulnar joint. So first one we will see proximal radioulnar joint. Proximal radioulnar joint. First one posterior gliding, second one anterior gliding. Here these movements we know. Radioulnar joint movements we are having supination and pronation. These are the forearm movements, radioulnar joint. So posterior gliding to increase the pronation of the proximal radioulnar joint. First we are seeing proximal radioulnar joint. In this proximal radioulnar joint we will be having posterior gliding and anterior gliding. In that posterior gliding, it is going to helpful for the increase of the pronation movement, Anterior gliding is going to improve supination. Anterior gliding is going to improve the supination. In this both posterior gliding and anterior gliding, we are going to move the radius bone. We are going to give glides to the radius bone only. Okay, then dorsal glide increases the pronation and antral glide increases the supination. So this is about superior radioulnar joint mobilization. So again, radioulnar joint mobilization, here distal radioulnar joint mobilization. Here also we are having posterior gliding and anterior gliding. So these two to increase the supination and pronation of the distal radioulnar joint. So this
the forearm mobilization. For forearm mobilization, we have superior radioulnar joint and inferior radioulnar joint. For superior radioulnar joint,
to move here radius, we have to give distraction force. Here I am keeping my thumb over the radius, then now here I am giving posterior anterior glide. In this direction we can give posterior anterior glide. Anterior posterior glide we have to give traction, then here we should stabilize the radius, then from anterior to posterior will give glide like this, anterior posterior glide. Yes.
For inferior, we have to catch the radial styloid process and ulnar styloid process.
Now this is for inferior radioulnar joint. Here both in superior radioulnar joint, inferior radioulnar joint, to get pronation movement and supination movement, we have to mobilize the radius only. So here to do inferior radioulnar joint mobilization, here styloid process, this is radial styloid process and ulnar styloid process, we have to hold. Then radius bone we have to move. See, now I am moving radius. This posterior anterior posterior glidings of the radius we have to do. So this is inferior radioulnar joint. Now we are showing it posteriorly. Same here we have to hold radius styloid process, ulnar styloid process. Then we have to move the radius bone anteriorly and posteriorly. This is inferior radioulnar joint mobilization.